Good evening, everyone. We are going to start in just a few minutes. We are running in some technical issues, so we're just going to connect with our guest, and we'll get back to you as soon as possible. So just bear with us. We'll be back in a few minutes. Hello, everyone. We are still having a bit of difficulty. Please bear with us. We're trying to figure it out. There's something in the link that's not working, and we'll be back very soon as we figure it out. Please be patient with us.
Okay, I will hang up now. Thanks. All right. Hello, can you hear me?
Yes, can you turn on your camera, Linda? And because everybody's there and we'll be ready.
There we go. Sorry
There.
about that.
Hello.
Now we're all connected. Great, thank you. Thanks
So
for
good
that.
evening, everyone. We're very sorry about this little technical difficulty. Today we're going over the new guidelines for exercise and cancer, and we have with us Dr. Linda Trinh, who will be presenting the new guidelines. Dr. Linda Trinh has a presentation, and after the presentations, we'll take your questions. So I am going to make you presenter so you can show your presentation.
Okay, so I'm going to share this, show my screen. So can everybody see the slides?
Yes, we can.
Okay, perfect. So I'll just get started. So my name is Dr. Linda Trinh. I'd like to thank Mona and Stephen for having me on this webinar today to present the updated guidelines.
Linda, your sound went off. Hold on. Linda, we can't hear you anymore. Okay, we can't hear Linda
Overall,
anymore.
the 5-year net.
Oh.
Sorry, can you still
Linda,
hear me?
we couldn't hear you anymore. Your sound just came back.
Oh, my sound just came back? Okay, perfect.
Yeah.
Can you hear me now?
Yes.
Okay, perfect. So I just wanted to say that overall, the 5-year net survival rate for people diagnosed with cancer is about 63%, but that varies widely based on the type of cancer. Some cancers have high survival rates, some of them have lower survival rates, but we know for, at least for kidney cancer survivors, you can see that the incidence of kidney cancer is about 9th or 10th most common cancer, and we see that the mortality rate is decreasing in kidney cancer survivors. So this is an encouraging statistic because it suggests that kidney cancer survivors are living longer. Living longer at first appears to be beneficial, or at least good news, but a lot of kidney cancer survivors will be experiencing many side effects that need to be treated throughout their cancer care trajectory or into survivorship. So one of the important things is to try to identify some non-pharmacological, low-cost, sustainable interventions to alleviate some of these side effects. And physical activity has been shown to be very beneficial for reducing fatigue in many cancer survivors. We know from there's now strong evidence for exercise in terms of cancer prevention in at least 7 different common types of cancer. It includes colon cancer, breast, endometrial, kidney cancer, bladder cancer, esophageal cancer, and stomach cancer. So there's now evidence to suggest that exercise has a protective effect for 7 of the most common types of cancers. So exercising during and after treatment decreases fatigue, anxiety, and depression. It improves physical functioning and quality of life and does not exacerbate lymphedema in breast cancer survivors. There are now numerous guidelines that have been developed from the World Cancer Research Fund, the American Institute for Cancer Research, the American College of Sports Medicine, that suggests that maintaining a healthy lifestyle is a key component to many cancer prevention and survivorship recommendations. And this includes being physically active and being of a healthy weight. And after a cancer diagnosis, you should follow as many of these recommendations as you can. So these are the common recommendations that you will see in many of the organizations that are advocating for guidelines for leading a healthy lifestyle. Recently, there have been updated exercise and survivorship guidelines for cancer survivors, and there's been a number of different statements that have been released. So you may have seen the Cancer Care Ontario exercise guidelines. There are ones by the American Cancer Society, the Clinical Oncology Society of Australia, as well as the American College of Sports Medicine. The American College of Sports Medicine just recently updated their exercise guidelines just last week, and it was released recently, and I will go through some of those guidelines and what the new guidelines recommend. But I'd like to bring attention to some of the benefits of physical activity for cancer survivors. That also includes kidney cancer survivors. As I mentioned previously, physical activity can increase your quality of life. It can reduce cancer-related fatigue, which is a major symptom for many of the cancer treatments. It can improve cardiorespiratory fitness. Fitness is a powerful indicator for mortality, so it's important to maintain that. Also, it can reduce body fat. It can improve chemotherapy completion rates, increase overall survival, and reduce recurrence. It can also reduce your risk of getting other chronic diseases, and it also helps you get things back to normal, as many cancer survivors would indicate. There's been now some of the research that we've done to look at different types of physical activity programming for reducing fatigue. This is a study that has been done with over 700 kidney cancer survivors, and we wanted to look at whether or not their fatigue changes with meeting various different types of physical activity. So we see at the bottom here are the different types of physical activity. So it's compared to doing nothing at all or doing combined. Combined is an aerobic and resistance training program. And then we compare the combined versus doing strength only, or combined doing versus aerobic only, and then doing aerobic versus neither. So we see that on the left side, you can see the mean difference in fatigue. So the higher the score, the better the quality of life. So we can see that doing a combined program of both aerobic and resistance training is better than doing nothing at all in terms of for fatigue. So we see the most beneficial effects for doing a combined program. So if you do aerobic and resistance training, you have better effects for fatigue, at least for reducing it. We also see that there are some preliminary studies to suggest that physical activity improves survival in kidney cancer survivors. So this was a study that was done with about over 600 kidney cancer survivors. And what they wanted to look at is to look at whether or not the different categories of physical activity that you do post-diagnosis, so after you've been diagnosed with cancer, and whether or not that's associated with all-cause mortality, so dying from any cause, and renal cell cancer mortality, so dying from kidney cancer. So what we see here is that in the red box highlighted, these are hazard ratios. So hazard ratios is a statistic that shows how often a particular event happens in one group versus another over time. 1 represents no difference, and less than 1 represents reduced risk, whereas greater than 1 represents increased risk. So if you can look at the model 3 here, if you do The 1 hour per week is a reference group, so that's just no difference in survival. But you can see that with increasing number of physical activity hours per week, as you move from 1 to 3 hours, 3 to 7 hours, and 7 hours or more, you can see that risk reduction decrease. So in terms of, sorry, not risk reduction, but survival increasing, meaning that the more physical activity you do, the less likely you are to dying from any cause. We don't see any statistically significant results with renal cell cancer mortality in this particular case, but at least there's a protective effect for overall mortality. There is another study that's shown that at least individuals who reported any physical activity were 53% less likely to die from kidney cancer than non-exercisers. So this was done using a national health information survey with over 200,000 individuals. So you can see that there's that little orange box that is below the 1 line, that any exercise appears to be beneficial for kidney cancer survivors. The updated recommendations now suggest that cancer patients and survivors should perform aerobic and resistance training for approximately 30 minutes per session 3 times a week to achieve health benefits, and to use sun protection while exercising outdoors. And you should exercise to your abilities and what you can tolerate. So the minimum dose to exercise is at least 3 times a week, 30 minutes per day of aerobic and resistance training. If you cannot achieve 30 minutes per day, any activity to as much as you can tolerate and to your abilities would be beneficial, and it would be better than doing no physical activity at all. So these were the updated guidelines, and it's different from what the guidelines for the general population suggest. So the general guidelines for the general population suggest 150 minutes of moderate to vigorous physical activity, which many of you might be familiar with or have heard, but it was unachievable or very difficult for cancer survivors to achieve. But we now have evidence to suggest that at least doing 30 minutes per session is beneficial. So how can you achieve these recommendations? 90 minutes of physical activity per week sounds quite daunting for a lot of individuals, especially if you haven't been active before or you're thinking about becoming active, but it's actually not very difficult to get 30 minutes of physical activity. So you can actually do 10 minutes in the morning, 10 minutes at lunch, or 10 minutes in the evening. You can accumulate it in any amount of time throughout the day to get 30 minutes. So you can do it 10 minutes per session, or you can do it 2 minutes in the morning, 5 minutes at lunch, and then the rest in the evening. So any combination that you do throughout the day counts towards the 30 minutes. So what types of activities should you do? You should try to do moderate intensity exercises. So those are exercises that make you breathe harder without feeling out of breath. So you should still be able to carry a conversation, but you can't sing. Some of these examples would include walking quickly as if you were late for an appointment. Easy bicycling, easy swimming, dancing, canoeing, or golfing. These are all examples of moderate intensity exercises. So you can achieve the 30 minutes a day of exercise just by walking, for example. If you choose to and you're comfortable with doing vigorous intensity exercises, these are ones that where breathing should be rapid and deep. You can't say more than a few words without pausing for a breath. So that's when you know you're in sort of the vigorous intensity exercise. Some of these examples will include jogging, running, attending an aerobics class, cross-country skiing, vigorous swimming, vigorous bicycling, and skating, for example. And you should always try to incorporate some strength training into your routine as much as you can. And this doesn't have to involve going to the gym. You could lift dumbbells if you wanted, but you could do chair sit to stands, where you sit in the chair and you just do chair stand up and sit down to build strength in the legs. You can also do kitchen counter push-ups. Another thing is that you can use resistance bands at home to engage in strength training. So the activities that you do is completely up to you. There is no set guideline in terms of the activities that you have to do. Whatever you choose, just make sure it's fun and enjoyable, because if it's fun and enjoyable, you're more likely to stick to it than doing something that you don't like. If you don't have a gym membership, that is fine as well, because you can always engage in walking, and that is the preferred modality for many cancer survivors. In the research that we've done, walking is the preferred modality for many cancer survivors to achieve their physical activity goals. You may be wondering that there are specific barriers that you might be facing while on treatment or post-treatment, and these are the most common barriers that other kidney cancer survivors have indicated. Barriers to their physical activity participation. The very first one is I have no time. So that is the main barrier that kidney cancer survivors have indicated that would prevent them from exercising. So one of the things that you can do is that you can exercise first thing in the morning. So you have that done and you don't have to think about it for the rest of the day. You can use exercise as part of transportation. You can exercise longer duration during weekends. You can schedule a workout as if it was a meeting or an appointment in your agenda. The second part is I have to work during the day. So you can be active during the lunch hour. You can plan active work meetings. So rather than sitting down and having a meeting, you can actually do walking meetings. You can start walking to work or getting off a few stops early from the bus in order to walk to work. The other thing is I am too tired. So you want to exercise on days and during times when fatigue is lowest, if you're able to predict that. You can reduce the intensity and duration, but try to avoid inactivity. And again, you can accumulate exercise in any amount throughout the day to achieve that 30 minutes. The next one is what if I have other health problems? One of the things is you can exercise at a level that you can tolerate. Choose low impact activities, and again, accumulate as much activity as you can in any amount throughout the day. If it's too hot or it's too cold outside, you can engage in mall walking, or you can be active in the middle of the day when the weather is the warmest. But if you don't have a gym where you live, you can choose an activity that involves minimal walking, equipment such as walking. You can locate parks and trails nearby, or at least consider buying a bike or a treadmill at home. And one of the things you can do is to start a plan for physical activity. We find that when cancer survivors plan for their physical activity, they're able to stick better to it, and they're able to engage in physical activity. So for example, you can see in this particular case that this person chose to do walking on Monday, but they didn't do walking all at once. They did 5 minutes in the morning, 10 minutes at lunch, and 15 minutes for the 30 minutes a day. And then they decided to do some walking on Sunday. So there you have 60 minutes of physical activity. And this person also decided to do swimming on Wednesday, which is another 30 minutes. So there they already have 90 minutes of physical activity. And they can engage in 2 weeks of strength training, 2 days a week, either on the Tuesday or the Friday, however combination you choose. And then they have 90 minutes plus 2 days of strength training. It's also beneficial to indicate where you will complete your activities. So in this case, this person said they will complete their activity at a gym and a walking track. And also who you plan on being physically active with. So if you plan on finding the social support person that can keep you accountable, you can also indicate who you plan on being active with. And that helps. We find that planning does help to stick to your exercise routine. So if you're interested in becoming more active you should consult your doctor before beginning any exercise program. But Kidney Cancer Canada has a free exercise guidebook for you to download. And I've provided that link here. And this is a very comprehensive book that really gets you started on an exercise program for kidney cancer survivors. So it has a lot of information about how you can begin an exercise program and how you can maintain it. And it also includes a sample walking program at the end. It's free online for you to download, and I encourage you to take a look at this to start being physically active. So I have my contact information here.
Linda, can I interrupt you for a second? Stephen, can you hear us?
I can.
Okay, because we can hear you talking.
Thank you very much. Thank you. Right. I will mute my mic. I do apologize.
That's okay. I'm almost done here. So essentially, I just
it's taken me forever just to get through. Yeah.
Yeah.
So I have my contact information here. So feel free to reach out to me personally afterwards. The webinar, if you don't feel comfortable asking questions during the webinar, I'm available to answer your questions. So thank you for your time. And now I will open up the webinar for questions.
Great. Thank you very much. It's Stephen Andrew. And unfortunately, just seconds before we went to air with this webinar, I do apologize, but my internet went completely down. And of course, if it's going to go down, it's going to go down just seconds in front. So on the right-hand side of your screen, ladies and gentlemen, there is a chat box. Please put your questions in there. and then Dr. Trin will answer them. And I personally want to thank you on behalf of the board and staff, Dr. Trin, for joining us this evening or this afternoon, wherever you may be located. This is great information. And while the questions are coming in, which Mona will feed to you, I'd like to ask you just a couple of questions.
Sure.
So patients often tell us they are too weak to exercise, and therefore it seems counterintuitive to say to a patient to move when they really feel very, very bad, and can't move. Can you talk a little bit about that, please?
Yeah, sure. So one of the most common side effects is fatigue, and it does sound counterintuitive that if you're very tired and you can't even get up to do your activities of daily living, that you can even think about exercise. But there is strong evidence and compelling evidence now based on the updated guidelines to suggest that exercise has beneficial effects for alleviating fatigue. So if you exercise 30 minutes a day over a 12-week period or more, you can actually reduce your fatigue. So there is overwhelming and strong evidence to suggest that now exercise is beneficial. So it's no longer the case that we advise cancer patients to rest or to engage in no activity. They are now encouraged to do as much physical activity as they can tolerate. And this doesn't mean that you have to go out and do 30 minutes of jogging. You can do as much as you can tolerate into your abilities.
Does that mean like just basically a simple walk just outside, maybe down the path very slowly and then walking back? Again, if you're not feeling great, and of course what happens, Dr. Trin, is that people get really challenged with their appetite during that time. And we've always recommended, a couple of ideas that have come out is that people, if they're having a hard time with their appetite, should try to remove themselves from the house while dinner is being cooked, and then come back in just as it's about to be put on the table.
I think that's a great suggestion. And if, when we encourage exercise, we try to encourage exercise where you can comfortably do it. So if it's close to home, even if, you go outside and you walk sort of down the street and walk back, that is fine as well. Even walking around the block, we're not advocating for walking the entire 30 minutes. Even if you accumulate small bouts of walking throughout the day, if you can only do 2 minutes at a time, or do maybe 3 minutes here and there, that's still better than no activity. So I think we try to encourage as much as activity as possible.
And for those patients that may be in stage 4 cancer and having a bit of an issue with their hand and feet syndrome, especially with immunotherapy or diarrhea. I mean, as a patient, I can tell you that there were times I did not want to move 2 inches from my washroom just in case things were happening. And it just compounds. I wonder if you could talk about that a bit.
Yeah, so in that case, I mean, it depends if if those symptoms are better on some days or they're just worse on every day. Sometimes those symptoms alleviate on certain days, and sometimes it gets better. Sometimes they're not as sore. So I would say encourage cancer survivors to be active during the days when it's not so sore, or during periods of the day where you feel that it's not going to bother you as much versus days where it's really really bothersome. The other way you can think about is that if you have a stationary bike at home, something that where you can sit and ride a stationary bike at home might be helpful. You can even do arm, upper body movement, arm exercises. It's still doing some sort of movement. If you find it really troublesome to engage in any exercise, I think moving would be even doing transitions such as sitting to standing would even be beneficial. So try not to sit for the entire day, but try to break up your sitting time with small amounts of standing. That would be something that would also be beneficial.
Do we have any questions, Mo?
Yes. A question from Eve. She thanks you for your presentation, and she asks, what are the main differences between these new guidelines and the previous ones?
The previous guidelines, when it was released in 2010, so that was almost a decade ago, we didn't really have that much evidence to suggest that exercise had benefits for cancer survivors. There was some, but it wasn't enough to recommend a specific dose and a specific type of physical activity. So we just, at that time, the American College of Sports Medicine decided that, there was enough evidence to suggest that cancer survivors should at least be moving. So they decided to make it in line with the public guidelines for Canadians and Americans, where they said 150 minutes of moderate to vigorous activity. So now, a decade later, the panel reconvened for the second release of the new guidelines, and actually indicated that 150 minutes of moderate to vigorous activity was very difficult for many cancer survivors to achieve. So now we have enough evidence to suggest that there are certain types of symptoms, such as fatigue, anxiety, and depression, for example, physical functioning, that we can now prescribe specific doses of exercise, where 30 minutes a day, 12 minutes or more, 12 weeks or more of aerobic and resistance training is beneficial. So these new guidelines suggest that you can do a minimum of 90 minutes of physical activity per week with 2 days of strength training, and that's enough to have benefits. So that's a departure from the 150 minutes of physical activity per week. So we now have specific guidelines for specific symptoms, but also the guidelines have been updated to suggest that any sort of movement or activity would be beneficial. So that is the main difference.
Next question, Mona.
Yeah, Karen is asking whether that changes what we have in the exercise guide available on our website.
So the exercise guide advocates for 150 minutes of moderate to vigorous activity, and it says to accumulate in 10-minute bouts. So there is a little bit of a change in terms of that, but right now we don't really have strong evidence for cancer sites beyond breast, prostate, and colorectal. So the other cancer sites are still under study. So I think the guidebook is still relevant in that, yes, it's advocating for moving during treatment and moving post-treatment, but you can now achieve, you can try to achieve 150 minutes, but any activity is better than no activity. So at the very least, do a minimum of 90 minutes of physical activity, 30 minutes per day, 3 times a week. And if you could do more and you can try to achieve the physical activity guidelines for 150 minutes, you might have better benefits for doing more. But we don't really have much evidence to suggest that doing above and beyond 150 minutes has greater effects for cancer benefits. There's insufficient evidence to suggest a benefit for that.
Mm-hmm. We have
another. Are you doing any work studying? Are you, Dr. Trin, are you doing any studies on kidney cancer and exercise at the moment?
Yes, we are. We have a trial that has been funded by Kidney Cancer Research Network of Canada. So we're actually looking at cognitive functioning as an outcome. So we're trying to design an exercise program for metastatic renal cell carcinoma patients to examine the trajectory of cognitive function changes with their treatment, either whether or not they're on targeted therapies or immunotherapy. We're trying to look at how exercise is associated with cognitive functioning before they start treatment and 3 months into treatment. So we're looking at the trajectory of cognitive decline and whether or not exercise is associated with at least alleviating cognitive decline or preventing it from getting worse. So there is some evidence to suggest that targeted therapy, very preliminary, that cognitive function does decline with cancer and its treatment. So we're trying to identify the most opportune time to intervene with an exercise study. And cognitive functioning is one of those outcomes or symptoms that the American College of Sports Medicine has identified as having insufficient evidence, not to suggest that cancer survivors don't experience it or exercise is not beneficial for cognitive functioning. It's just the literature is very sparse at the moment to determine any protective benefits. But at least in the older adult literature, we see that the more exercise older adults engage in, the better their cognitive functioning.
That was a loaded question because I know, of course, you are doing that research. And just for everyone in attendance, Kidney Cancer Canada funded that that study, just so that you're aware of that research. We'll get to the next question in just a second. I also want to talk about the challenges of not exercising, even if you're not on medication, because the body seems to know. I mean, the same with my dog, that the body just doesn't function. There's you know, urination and defecation doesn't seem to be as consistent if you're very sedentary.
Mm. So, sorry, the question was just how you.
Is there evidence on that if you remain very well, I won't call it lazy, but sedentary, very tired and sit in a chair all day and don't get up and move around, what effect would that have on your system?
Right. So right now, in terms of sedentary time and let's say cancer survival, there is limited epidemiological data right now linking sedentary time to cancer survival, which is a very compelling clinical outcome for many survivors and clinicians. So there's a modest, about like 12 to 13% higher risk of cancer mortality for higher versus lower amounts of engaging in sedentary behavior. So the guidelines around sitting time is still insufficient. We don't have enough data to suggest that, but at least if you're engaged in high amounts of sitting time, it is you won't experience the beneficial effects that it might have for some of the most common symptoms, such as physical functioning, fatigue, anxiety, and depression, that exercise can help alleviate. So in terms of staying sedentary, I think what you want to do during cancer and its treatment is to avoid inactivity as much as possible. So try to move through treatment and into survivorship, not only just for you know, for the cancer symptoms, but for returning back, getting things back to normal and reduce the chance of your cancer coming back, and even to improve your quality of life, as well as the prevention of other chronic diseases that may happen. And we know cardiovascular disease and diabetes, for example, are linked to physical inactivity.
Thank you. Mona.
A question from MJ. I understand that the guidelines were reduced because it was difficult for many patients to achieve them. Is it okay to continue to follow the guidelines for the regular population?
Yeah, absolutely. You can continue to follow the guidelines and try to reach 150 minutes of moderate vigorous activity if you can tolerate it, and if depending on your abilities. But if you're looking to start an exercise program and you've been inactive, I think of trying to achieve following the new guidelines of 3 or more days per week would be beneficial. So the minimum would be 3 times a week at 30 minutes, but if you can do more, I think you can try to do as much as you can tolerate. And then, but just also remember to incorporate the 2 days a week of strength training. And now the guidelines do suggest that you should use sun protection when you're exercising outdoors. So that is a new inclusion in the guidelines.
And another question from David. Is there risk of over-exercising by cancer survivors?
Well, I mean, you know, it's probably rare that a cancer survivor would be over-exercising. Again, whatever activity that you're engaged in, I think you should let your symptoms guide you in terms of how you feel and how much you can tolerate. If you are deciding to work with an exercise trainer, or at least, you know, working with a healthcare professional or exercise professional, ensure that the exercise professional understands the cancer that you're going through and understands the treatment that you've gone through and the side effects that it has, so that they can be able to tailor an exercise program to your abilities, but also to adapt it when your symptoms get worse, or if there's a change in your health status. So that's more of an important key, rather than, you know, you over exercising. I think again, there's no evidence to suggest that, or insufficient evidence to suggest that going beyond 150 minutes is beneficial, but I think like if you can achieve the minimum guidelines, the updated guidelines, and if you can do 150 minutes, great. If you can do more and you feel okay, right now the evidence doesn't suggest that doing more is harmful or beneficial. It's just insufficient evidence right now, so we can't comment on it because we don't have any evidence to suggest that it wouldn't be beneficial.
Mm-hmm. And a question from Hélène. When you're on treatment, is it better not to, sorry, because I'm translating,
Yeah.
not to go over a certain cardiac frequency?
No, during treatment, you should be encouraged to be as active as you can tolerate. Again, the guidelines, whether or not you're on treatment or post-treatment, suggest that you should at least try to do 30 minutes of exercise three times a week. So, and during treatment, it might be more difficult because of the side effects. So you might need to accumulate 30 minutes a day differently. So you might have to do a couple minutes here, a couple minutes throughout the day to get to your 30 minutes. And there are some days where, perhaps trying to do moderate physical activity is very difficult. So that's moderate physical activity would be something like brisk walking as if you were late for an appointment. In that case, you can even do light physical activity or try to avoid inactivity as much as possible. So if you can't do the moderate activity, I would say, try to, move as much as you can, even if it's just engaged in a casual walk or light physical activity.
And I have one last question from Saeed,
Yeah.
who says he's on Sutin 50 milligrams, 2 weeks on, 1 week off. What exercises can he do?
Okay, so it depends on the side effects that he's experiencing. So are there any side effects that you currently has?
Saeed, why don't you write us what are the side effects that you have so we can better answer your question?
Would you, Stephen again, would you recommend patients downloading a STEP app onto their phone and trying to find this? I mean, that I find is often a motivator. Many people go around and say, well, I haven't done my 10,000 steps today.
Yeah.
And it's kind of fun in a way to do it when you can, of course.
Yeah, and I think it would definitely be helpful to, if you have an activity tracker, if you have a Fitbit or an Apple Watch, or even downloading an app on your phone that keeps track of your steps. I think it's a great way to at least self-monitor how much physical activity that you do. The recommendations, at least for steps per day, is actually 7,000 to 9,000 steps, according to the updated guidelines. So gradually build up to a daily step count of 7,000 to 9,000 steps. If you can do 10,000 steps, great. But you'll find that you'll probably start feeling better when you do 7,000 to 9,000 steps. At least that would be the minimum recommendation. So that's a great motivation tool. And I would definitely encourage you, if you're interested in self-monitoring or just interested in, doing some friendly competition with people in your social circle, I think it's a great way to keep motivated.
This would be a great project that perhaps we could engage in either on the kidney cancer chat room or in the Facebook support area to kind of encourage one another and see if we can get our activity up, because we know it is an issue. And from the latest global survey and the Canadian results, we know that Canadians have a significant amount of anxiety about their treatment plan and their future. And the exercise will definitely help with that. It's one of the areas that we really want to look at, because mental health and awareness is a key factor, I think, in to a better prognosis.
And anxiety is actually one of those symptoms that there are now strong evidence, at least for a specific exercise guideline, where aerobic training 3 times a week for 12 weeks or more, 3 times a week, plus resistance training can actually significantly reduce anxiety in cancer survivors, both during and after treatment.
For Saeed, he says he has no side effects except
Okay.
for some head sores.
Okay.
But I have another Eve. She's on Sutent and she has all the side effects
Hmm.
other than foot and hand problems.
Okay, so I would say that because you are right now on treatment, I would say consult your doctor or your oncologist and let them know that you're interested in an exercise program. I think that's the first thing that you can do, let them know that you're interested in exercising. What that might prompt them to do is they can provide you with any sort of advice on sort of what things to avoid at least, but I think you can engage in the regular physical activity guidelines if you have no side effects. If you have head sores, maybe try to do activity on days or times when that maybe where you feel that the least. For patients who have many side effects or at least experience all of them, perhaps doing sort of a home-based program or doing a program near or around the home, such as walking, might be beneficial so that you can, you know, if you need to go back home for any reason, or if you're not feeling well, or exercising in an area or doing walking by an area where there's several benches that you can take rest in between, that would be fine as well, and that would be what I would recommend. But if you're interested in more structured program, there is the guidebook here, but there's also these community-based programming, and I know Wellspring has a number of programs, at least low cost or no cost at all, that are geared towards cancer survivors. So any cancer diagnosis, you can go and participate in their 12-week program, and they are dedicated trainers there that understand exercise in cancer, and what they can do is give you a tailored exercise program that you can follow right on their facility. So there's a couple of different Wellspring locations. There's one near Sunnybrook and there's one in downtown Toronto, and I believe there, if you go on the website Wellspring, you'll see a lot of other locations as well, and those are community-based programming where you can actually contact them and enroll in an exercise program, and they will give you all the tools to get started in an exercise facility, and it's all supervised, and you can choose the activities that you enjoy. For post-treatment, I would say if you're feeling pretty good and you don't have many side effects and you're done treatment, I recommend downloading this exercise guidebook to help you get started.
And for those of you who live outside of the Greater Toronto area, such as myself, I live in Victoria and Mona lives in Montreal. May I suggest that you contact your clinic, maybe if you have a nurse navigator or you have a clinical trials nurse, or if you have you speak frequently with a nurse when you go in for your appointments, speak to them and they'll be able to steer you directly to physiotherapy or to exercise programs that are available in your area. If you don't find anything, please do write to us. You can do that at info@kidneycancercanada.ca. That's info@kidneycancercanada.ca, and we'll have a look for you and see what we can help you find. Were any other questions, Mona, before we close?
No, David says thank you for this session, but before we leave, I'd like to show everyone where they can download that guide, because that, you know, I know that's the email address, but it's kind of difficult. So if I can just share my screen, and I will show you where to get it, okay? Just bear with me 1 second. Can everybody see my screen?
I don't see your screen, but I stopped sharing my screen, so do you see my screen still, or?
No, I do not. Hold on. Okay. Do you see it now?
I do not see it.
No? Okay. Here?
No.
Why don't we talk everyone through it? If you go to kidney, oh, there we go. Yeah,
You
there
see
you go. Yes, now we see your screen.
Really? Okay, I didn't
Yeah.
do anything. All
It
right.
just took a while.
Yeah. Okay, so this is kidneycancercanada.ca, and that's our homepage. So right here, you've got order-free resources. All you need to go is go under.
It's a little delayed, Mona. Sorry
Oh,
about that.
okay. Tell me when you can see patients and caregivers.
Is that your screen or is that your screen, Dr. Trin?
Which screen? I don't see
I
any
see
screens right now.
Oh, okay. So we'll talk them through it, Mona, because I think that
Okay,
just
all
we're
right.
still a little bit hung up there. Okay.
All right. So under the so kidneycancercanada.ca, you'll see an icon which is order free resources. And then you go under patients and caregivers. There you'll see all the resources we have, and there is the guide there. You have to actually click on the icon of the guide, and you will be able to download the online version.
That's great. So kidneycancercanada.ca, and
Yes.
then under the banner that's up there right now, which will be the Halifax meeting, you'll see four icons that go across from left to right. You'll see newly diagnosed. Then you will see order-free resources, and that's the one you want to click on. Then you will see two options, caregivers and patients, or you will see healthcare professionals. Click on caregivers, and then you will find the exercise guide there. Just click on that and you'll be able to download it. So you can get it tonight. That's great. Okay. So thank you everybody for joining us tonight. It's a real pleasure to be doing this. Just a reminder, if you are in the Toronto or Hamilton area on November the 20th, please join us at St. Joseph's Hospital. On the front page of our website, you'll see that we have a patient, caregiver, survivors, and family meeting on the 20th from 6 till 9. And that's with Dr. Anil Kapoor, Dr. Sebastianot, myself, Stephen from Kidney Cancer Canada, and also you can see the ominous voice from Montreal, Mona, will be there as well. And we also have a couple of meetings across the Maritimes. We have one on November the 10th, which is going to be held at the Marriott Harborside. That is from 2 until 4 p.m. Halifax time. And then on the 12th, we have another meeting which is being held at the Delta Convention Center in St. John's, Newfoundland and Labrador at 7 o'clock until 9. So all of this information is on the website. And again, if you ever need any information, if you just go to kidneycancercanada.ca, at the bottom of the page, there's a form you can fill out and it will send us an email right away and we will get back to you. Thank you so much, Mona, for taking over to fill in for my terrible internet here in Victoria today. It seems that the whole island has gone down for some reason. And Dr. Trin, Dr. Linda Trin, thank you for doing this. And thank you for all the work you do for kidney cancer patients and for us here at Kidney Cancer Canada. A very interesting session. And we will definitely get you back very, very shortly. Thank you.
Great. Thank you for having me.
Thank you, Dr.
We will. This webinar has been recorded, I believe, right, Mona?
Yes, it has.
So what we will do is once we sign up, and we'll be doing that very, very shortly, we will post it in the next week so that you can review the topics that Dr. Trin covered. Have a good night, everybody. Thank you so much.
All right,
and thank you for all your support.
Bye-bye.
Bye-bye.